This episode is brought to you by Dwell New Jersey. Steph Mann and her team are helping you buy, sell, and enjoy life in New Jersey. Check them out if you need help with pre-listing services, home renovation consultation, finding a realtor, closet edits, and small business consultation. I know Steph personally, and she is amazing. So make sure that you check them out at dwellnewjersey.com. All right, welcome back to That Westfield podcast. Today we are joined by Dr. Katherine Pace of Haven Pelvic Physical Therapy, located on Elm Street in downtown Westfield. Welcome, Katherine.
Hi, it's so nice to be here. I'm really impressed that you said that whole thing without messing up the name.
I usually mess up the intros, guys, and I have to do it like 4 times. So yeah, this time I nailed it. But this is our, we're in a few episodes now, so I think everyone's getting a little bit more comfortable. It's getting a little bit easier. Yeah. So, but you were one of the first to sign up. So that was really cool.
I believe in you.
Thank you. Yeah, I think when you saw it, you were just like, this is interesting. Like, why not be a part of this? Because you do such a great job of doing a lot for the community and getting out there and, you know, telling the story of what you do. So I was super pumped to have you. But
thank you.
We're going to get into it. So tell everybody what pelvic physical therapy is.
Yeah. Good question, because almost nobody knows what it is. So pelvic floor physical therapy is physical therapy that is for your pelvic floor. So it's, if you've ever done regular physical therapy, it's similar to that, except our therapists have specialized knowledge in the pelvic floor. So anything related to poop, pee, or sex, that's what we do. We do it all. Any issues with that? If it's a muscular issue, we can help.
That's really interesting, because I think some people, their automatic thought is to go to just a regular physical therapist or a chiropractor and could, you know, possibly be treated for months or even years for things that, you know, it maybe helps a little bit, but it's not really getting to the root cause of the problem. So like, what are some of the issues that you see or people that you treat that come in specifically for this after, you know, maybe a couple of visits to somebody else?
Yeah. So our bread and butter is our pregnant postpartum mom. So usually that's when people start to notice that they have a pelvic floor issue. It's because during pregnancy and postpartum, there's a lot of stretching and a lot of stress on that area. So they might have leaking, incontinence, pain, and you know, with the advent of social media, it's become a little bit more mainstream, especially for our childbearing years population. But we get a lot of people, like I said, who are pregnant, postpartum, just having a little bit of issue getting their body feeling normal again. But we also get men, you know, so usually our male clients have really high-powered, high-stress jobs, and then they're having problems with urination, or they're having problems with sexual function. And then we have our perimenopausal, menopausal women who are having the same sort of issues, but now it's just a little bit later in life.
It's so fascinating, because I think a lot of people don't realize that misalignment in those areas can lead to, you know, issues that aren't just physical, right? It could be even emotional, or, you know, organ, like maybe something hormonal, right? Could be attributed to, you know, misalignment in that area. So what are some signs or symptoms that people would maybe consider going to you for that, you know, isn't maybe postpartum, but like other things going on inside their body that they should consider visiting you?
I always say, if you have like hip pain or back pain that's chronic, you've tried regular physical therapy, you've tried acupuncture, chiro, nothing is quite getting it, there's a large chance that your pelvic floor muscles are contributing to the problem. And, you know, no one looks there. No one talks about it. So, you know, sometimes that's the missing link to a lot of these chronic issues.
That's super fascinating. So how did you even get into this? I know, like, you were already, you know, doing physical therapy, but was there some sort of catalyst for you getting into this specifically?
Yes. So my oldest son, he's 14 now, and I've asked him many times if I can share this story. But when he was a baby, he had constipation issues. Now, all babies have constipation issues, but his was a little different, and I knew that his was a little bit different. And I went to, I don't know, 5 or 6 different pediatricians. We went to the emergency room a dozen times, and everyone was like, it's just constipation. He's a kid.
Did you know that because of your background, or as a mom, or a combination of both?
It was that mom instinct. But I was like, he hasn't gone to the bathroom in over a week. Like, this is not normal.
Right. And how old was he?
he was a year old at that time. So it was just progressively getting worse. And I said, you know what? I'm going to find my own specialist. So I took him to Manhattan, and the doctor looked at me and said, you have to take him to see the surgeon today.
Wow.
And so then I went. So I went to Long Island.
How scary and validating was that, right? You're like, oh, wow, someone's taking me seriously, finally.
Taking me seriously, but it was also a really big issue. So that's when I learned that he actually had a problem, and he needed to have 3 surgeries. Wow. Because people just kept gaslighting me.
Yep. Medical gaslighting is definitely real.
So instead of just 1 surgery, he had to have 3 because we waited so long. But his specific issue couldn't have been helped with just pelvic floor therapy, but I understand how patients with pelvic floor issues, especially if you're a woman or you're a minority, sometimes you just feel like you're not heard, but you also could be not a minority and not a woman and still feel really unheard when it comes to pelvic floor issues. So there is another avenue that you can look into.
I mean, that's something I could personally talk about for hours is, not being heard or understood as a doctor. Like last year I had a situation where I was really unwell, and the very short version of that was my thyroid was tanking, and they kept trying to give me antidepressants, and I knew that I wasn't depressed. And even though my thyroid was enlarged and my TSH was 12 when it should be 0 to 4, they kept telling me it was, oh, maybe it's your MS, maybe it's something else. And right? You have the intuition, when something's wrong with yourself or with your children. I think, I don't have kids, but I imagine that it's just a knowing that you have, and you always have to advocate really hard for yourself. And I imagine you see a lot of patients who've been dismissed or not heard. Probably almost, I would say, like 90% of your patients have probably been there, just because that's unfortunately how it works right now. So it's really, really needed to have people like you in the community who are willing to listen and understand and go, hey, I've been there, I've been in your shoes. Let's get to the root cause of this.
Right. And most of the time, these patients are not being referred by their doctor. They're really going on Google and kind of searching on their own, what can I do to fix this issue that I know is not going to be helped by another medication or another surgery? Like, what can I do? And that's how most of our patients find us.
Very cool. I've always heard nothing but great things about you personally. And then once we met, it was just, the energy is so nice. And, my wife is now a patient of yours. And, she said the same thing, like you just made the whole process so easy and comfortable for her, because it could be a little scary sometimes, especially when you don't know what's going on and you're looking for answers. I think there's always that anxiety of, is this doctor going to find something wrong with me? And are they going to be the one to help me fix it? And so, having great bedside manner, as we call it, is super important. I think that that's something that's lacking in a lot of medical care these days. So thank you for taking care of my wife. And, I'm sure everyone else, you have great reviews online too. I stalked you a little bit before you came on.
As you should.
Got to make sure everybody is legit who comes on this show. So tell us a little bit more about the other services you guys offer, your team members.
Yes. So we have 3 pelvic floor physical therapists.
Oh, wow.
Dedicated our careers. That's how much we love the pelvic floor. We've dedicated our careers to the pelvic floor. Between the 3 of us, we have over 50 years of experience. I will not tell you how old I am, but we have over 50 years of experience in pelvic health. So if you think that your issue is like nobody knows what to do, one of the 3 of us have probably heard and treated whatever you're going through.
Very cool. And I heard that you recently have like other services like massage therapy coming in, some prenatal stuff going on.
So we have Krista, and she comes in on Tuesdays. She does a lot of our prenatal massage, lymphatic massage, which I think is so good.
We had one the other day. She actually came here and gave me a massage.
Isn't she great?
Yeah. It was very relaxing, and it's crazy how the lymphatic system is, just, doing its thing. We don't even realize how important it is. And I was so tired afterwards, but I felt amazing. Yeah, because, I have some like detox issues, but like, for me, I was just zonked for like 2 or 3 hours, but which is good. That means it's working. That means something was happening. So if someone hasn't tried that before, I definitely encourage you to give that a go at your place as well.
And we're always trying to support our mom community. So we have lactation consultants and a doula who's coming on in maybe in 2024, hopefully pretty soon. So we just hope to have that community for for our moms for Westfield.
That's huge. You know, I think it's something that it's such a special time in life, and it can be really stressful. So to build a team, a team of people, caring professionals who would just be there for you when you need them is super important. So that's really great. You moved offices last year, right? Or was it the year before? So you're growing. Things are expanding. That's good.
Yeah, I was right above Blue Mercury. Loved that. I loved being in the center of town, but sometimes it was a little loud. But we needed a bigger office, so then we moved just down the street I always say by Trader Joe's. Everybody knows where that is. So that's where we are now.
Same building as Quest, is it?
Yes, right next to Quest. Yeah.
Yep. So downstairs, really easy to find.
Yeah.
Tell me how you guys ended up in Westfield. Are you from here, or did you end up moving here?
I've been in New Jersey for forever, but I was right before I started my practice. I was having brunch with my husband and my son at Turning Point, and the building across the street was empty, and I was like, oh my God, this would be the perfect place to have a pelvic floor clinic, because who comes to Westfield? People who are starting families because of the great education system that we have here, and it didn't happen to be that specific building, but in a couple of years, I did. I opened on Elm Street.
You manifested it.
I manifested it,
right?
yeah.
You're like, this is the place to do it. And it's true. It's such a great place to raise a family and start something. What I love about here too, especially being in the downtown, is like I could walk to any one of my doctors or practitioners. Like pretty much everything I need is right here, and it's really super convenient. So, what are some of your favorite places on Westfield? Your favorite places to eat, coffee, all that kind of stuff? Where'd you go to?
I will name every single.
Give me three.
I love getting cookies from Kirschenbaum. I love getting my French fix at Victoria's Cakes.
So good.
And where else? And I always eat at the place that was in Milburn and is now the sub shop.
Deli?
Yeah, duh. Yeah, Milburn Deli. Those are probably the three places.
Yeah, that place is pretty solid. Nice. So Haven Pelvic, what does that mean? Where did the name come from?
That's a good question. Before I started my own practice, I worked in the hospital system. And I loved working in the hospital system, but also didn't love it because my patients had to walk through cardiac rehab to come in. So if you're having an issue that's really private, having to walk through a dozen people to go to a back room and everybody's wondering, it's not a pleasant experience. Right. So I really wanted to create a place like a haven for patients to know that they will be safe, they will be respected, and they will be heard. So that's where the name came from.
That's really nice. Name's really important. People need to know what you do. And I think when I first saw your name on the door, I was like, Haven Pelvic. It made me definitely curious. I was like, I feel like obviously that's something health and wellness related. Yeah. But I didn't know exactly what it was, but it made me curious. It made me curious enough to look it up. So, and I love your logo, and just your space that you created is just so zen. It's so nice in there and calm and relaxing. When you go in, you're just like, okay, I feel like this is a place where almost it feels very homey. So, as opposed to a lot of doctors' offices that are kind of cold and scary and don't have a nice energy.
You want to feel safe and warm, especially when you're talking about these sensitive topics.
Yeah, definitely. I think women's health is something that is just so overlooked, and people, as we get older and we change, I'm 37 and I'm going through this the beginning of the hormonal shifting, and it's really awkward and uncomfortable. It's almost like the teenage years again, and you're relearning your body as an older adult, or not older, but a transitioning adult. So it's funny because I've been for chiropractic adjustments around my hips and have felt these crazy energy shifts. I would have a burst of energy, or even anxiety in the past because something was being moved or released. So
really?
Have you ever experienced some sort of energetic shift in what you do for people?
100%. Sometimes we do a visceral massage. So we do a lot of abdominal work. And if you do it with some patients, it actually gives them a lot of, they cry or they do this outpouring because there's a lot of emotions tied to that area. Sometimes when you release it, there's also a physical release. So that's kind of amazing, kind of scary if you don't know that it's coming, but it's a nice letting go.
Right. Yeah, I think a lot of people, I mean, it's something I've personally experienced for sure over the years with having, chronic illness is emotions being trapped in the body. And when you move things around, things can be released. And I think women know it intuitively, right? But you're just always like, was that because of that? And it's like, yes, it could be. And it's okay and safe to talk about these things. And the more we open up that line of communication, I think the faster people can heal from like chronic issues within their body. So, all right. Well, tell everyone where they can find you. I know you have Instagram, you have a website, and you have something really cool on your website that people should go check out.
Yes, because a lot of people say, like, am I a candidate for pelvic floor? Well, you can go on our website, havenpelvic.com, and take our quiz. Okay, I think it's under the resource button, but you can take our quiz. You can just click on whatever symptoms you have, and then it'll email it to me, and I'll tell you yes or no if you're a candidate or not.
I love it. And one thing that I love about what you do too is that you ask for your patient forms like days in advance before someone actually sees you, so you have the time to really dive into what's going on with them versus like you just walk into someone else's office and you're filling out forms and maybe someone just glances at it. Like I feel like you really take the time to do that, and obviously this person also has the quiz results too, so they're kind of like prepared to like go in and get ready to really actually be helped. So havenpelvic.com,
Pelvic Haven
on Instagram, guys. So switcheroony. We'll put some show notes in there so you don't miss it. But if you have any questions, I'm sure they could just call your staff. What days are you guys there?
Every day, except every weekday. So Monday through Friday, we're open late 3 days a week. So, and we have early mornings. So we always can fit you in our schedule.
And you don't have crazy long wait times. People don't have to wait months and months to get in to see you, right?
It's usually within 2 weeks we can get something.
That's really awesome. I love it. So guys, go follow them at Haven Pelvic and check out the website. pelvichaven.com.
You switched it.
That's okay. Wait, did I?
Yeah.
Shit. All right. All right, everybody. Go check them out. Dr. Katherine Pace and her team are ready to help you guys at havenpelvic.com.
Yes.
Thank you so much. This was awesome, and I think you're really going to help a lot of people. I can't wait to see what 2024 brings for you.
Yes. Thank you so much for having me on.
I'll see you soon. Ciao.